All right. Welcome and thank you for joining us tonight. I really love sharing different topics related to parenting, natural birth, cesarean birth, inductions, breastfeeding, anything and everything that's related to the journey that you make once you decide that you're ready to start a family. And that's just a really beautiful time. It's a time where we dive into learning different things about what to expect as we're moving forward. We want to have support and the insights to make the best choices for ourselves. And it's really nice to be able to have access to good information so that we can look and see if that might be something that we're interested in as far as choosing as we move through our pregnancies and into that labor and birth, which is so exciting. So I'm glad you're here with us tonight. And as I said before, my name is Allison Rollins. I am an owner of High Country Doulas, as well as a postpartum and labor doula. I'm also a childbirth educator and a health coach. And I work with families in that first year, excuse me, educating them on different aspects of parenting, that really crucial time of baby's first year. Let me get a drink. And something in my throat. So we are going to talk a little bit about everything and anything when it comes to natural childbirth. All right. So welcome again. We're so glad you're here. Remember that High Country Doulas does have many webinars that we do throughout the month. So if you sign up for those, you will be sent a link and then a recorded email of those. So you'll be able to gain that understanding and knowledge on that topic that you're interested in, even if you can't make the time of those webinars. So unmedicated childbirth. The labor and delivery of a baby is that's described without any kind of drugs, is the type of birth that has been prevalent throughout most of our history. By reducing the need for further medical interventions, an unmedicated birth allows you to be fully present physically and mentally during your baby's birth. In addition, minimizing interventions during labor can also lead to a faster post-birth recovery, not only for you and your baby. Of course, having an unmedicated birth won't be the right choice for everyone, right? It's not the right choice for everyone. However, it is important to be informed on your choices about how you can best prepare for it and if you're planning to pursue an unmedicated birth. So we're going to talk a little bit about that tonight and just understanding what can you do as you're preparing on planning for a potential unmedicated birth. So first off, what is an epidural? An epidural is known as a pain relieving intervention that birthing people can choose when they're giving birth. The explanation usually stops there, but we're going to talk about that. So what is it? What is a epidural really? An epidural is a local anesthetic injected into the epidural space or the space surrounding the tough protective coverings of the spinal cord. The injection blocks nerve signals from sensory and motor nerves, which translate to effective pain relief and immobilization of the lower body. So oftentimes when you have an epidural, a good epidural, what a lot of people consider a good epidural, women still have control of their limbs or their lower legs, but they don't feel the pain of the contractions, or they feel pressure but no pain. So oftentimes an epidural is used for moms who've had really long labors, a mom who has a low pain tolerance, and definitely for a number of other situations that can be a really helpful tool to use when it's needed or wanted or desired. If it's not desired, as a doula, I often walk women through what that's going to look like and help partners really support you as you go through that. I think it's really key to feel calm and have people who can kind of help you have the best experience possible through that. A lot of my clients are really scared of needles, and just the thought of that kind of scares them. And so as we work with a lot of different anesthesiologists and different people, our goal is really to make that experience, if it's needed or wanted, a really positive one. So regardless of how the procedure is done, the other aspect of it is a catheter. So when the anesthetic medicine is placed in your spine, it's done so through a catheter or flexible tubing. And that flexible tubing is inserted into the spine via a needle is placed there, and then the needle is removed. So there's nothing metal or hard left in your spine. Okay. The medication is on a continuous drip. So it is regulated through a pump, and then you have an additional dosing mechanism through a button. It's kind of like a remote that will dose you, but not overdose you. So if you need extra medication, your epidural is not working, you are able to get extra relief through that. So typically you feel little to no pain, and you only have to be hooked up, and then the relief stops, right? So like anything else that we get medication wise, it comes with side effects, and epidurals do have side effects. I don't tell you this to scare you. I tell you this so that you know. Some of those will include a drop in blood pressure, headaches that can be persistent, sometimes trouble with urination, infection is a risk, bleeding, and damage to the epidural space. Those are possible, but they're not very common. When and if you decide to get an epidural, your anesthesiologist or nurse anesthetist will explain all of those and answer any questions you might have about it. So we're going to move on and talk a little bit about other types of interventions. So when I say interventions, I mean these are pain management techniques, and some people refer to those as interventions. So birth is an incredibly individual experience, right? And none of us are going to have the exact same experience, nor will we have the exact same experience from one birth to the other. And there's no real way of determining what is right and what is wrong for you. You will work with your provider and your doula, if you have one, to help kind of guide you in knowing what your choices are, and then making those along with your provider. It's really important to kind of just be aware of risk associated with birth interventions. So you are really more equipped to make informed decisions about your birthing experience. According to the National Vital Statistics Report, birthing individuals who receive an epidural have a much greater chance of needing additional intervention. So what that means is that sometimes when you have an epidural, you may not, your contractions can slow down a little bit, which would mean that you might need to have Pitocin. So that's another thing added on there. Some women don't. It's not to say that you will. You just need to know that this could happen. And then also with an epidural, you will often need support from your provider to push, because you won't have the control capacity to push the same. It just means pushing might take a little bit longer with that, and you might need to have some more coach pushing. Some of the other things that are in this report are use of forceps vacuum extraction and cesarean section. So if you get an epidural, your risk of those things goes up. They can also create a longer recovery. So if you were to have an unmedicated birth, your recovery, you can get out of bed, you can go pee, all of those things are pretty much almost automatic. If you feel like it, you can do it. With these, there's more of a delay in that. But if it's needed, your nurses and your provider and your doula will help you walk through that. So. And oftentimes too, I will say that women, when they decide to have interventions, is often in active labor. So you're just kind of tired and worn out, and sometimes your labor is going really smoothly. So sometimes the later that you get an epidural, the less likely then those other things are to happen, because you have a really nice active labor pattern. Ryan Dickerson, who's an obstetrician from Baton Rouge, says that women who skip the meds will more instinctively push rather than exerting when they are told, which means less pushing and less tearing. Other reasons they may stay more intact, they generally don't need equipment. So women who don't have an epidural can feel better to push, and they may not need vacuum or any extra support with getting baby out. Right. He also makes an interesting point: whether women simply intend to have a drug-free childbirth or not, changes in their behavior are present throughout their pregnancy. Women who have decided that they will have a medication-free birth often make a noticeable effort to eat healthy, exercise, and practice relaxation techniques, as opposed to those who expect to utilize medicine. So this is from his point of view. Awesome. So let's think about considering, what are we going to do if we do want that medication-free childbirth, if we want to experience natural birth? What are we going to put into it to help our babies and our bodies get ready for that? So birth does not just start when you begin labor. In fact, it's sort of the main focus of pregnancy, right? To prepare your body and your baby. And every single day that you're pregnant is part of your preparation for childbirth. A good childbirth education class to help you understand all the aspects of labor is really key for a lot of first-time parents, especially. So consider this: if you were looking to strengthen your leg muscles, you wouldn't ignore factors in your life that affected this goal. You would exercise your lower body regularly, ensure that you were eating the right things, and give your body time to rest. So as women, our largest and most powerful muscle in our body is our uterus, right? It deserves that same attention. It must be strong and well nourished to successfully birth your baby. Once you're pregnant, and your health and your baby's health are really important to consider. So it is important to pay attention to the sources, the quantity, and the quality of the foods that you consume. And overall, the main goal of proper pregnancy nutrition is to expand your blood supply to aid in the growth of a healthy baby, placenta, and uterus. Other benefits are baby will be born at a healthy weight. You also decrease the risk of birth defects. You promote healthy brain development, decrease the risk of complications such as anemia, so low iron, preeclampsia, which is a high blood pressure for pregnant women, and gestational diabetes, so your blood sugar, a high blood sugar during pregnancy. It also lessens the prevalence of uncommon pregnancy symptoms such as morning sickness, constipation, fatigue, and more. Also lowers the odds of going into preterm labor, promotes a faster postpartum recovery, and helps balance your emotions through the pregnancy. All this really can be achieved by a healthy diet most of the time and being conscious of your food choices. So let's consider a little bit more of that. We're going to talk a little bit more about those food choices that we have when we are pregnant. All right. So eating healthy while pregnant. Really, in the first trimester, there is really not a lot of need to uptake your calories. It is important to more focus on the nutrition of the food that you are eating. So really thinking about food as different colors. Sometimes it's hard in your first trimester to really eat like as healthy as you would if you're experiencing a lot of nausea. So there are definitely limitations to eating for some moms out there. But I think hydrating, making sure you're drinking well, and eating small bits of food throughout the day can really help lower nausea for a lot of women, and eating protein early on in the day. So once you jump into that second trimester, you're going to be upping your caloric intake to by about 300 to 350 calories per day. So increasing that as you go through that. You may have cravings. You may feel like you need to eat more protein. You may crave, like a lot of women crave fruits or like watermelon that are full of like that juicy water. Some women have strange cravings like, pickles and ice cream like everybody else. But some of those cravings, listen to your body, but don't overdo it. A lot of women say, well, I can eat whatever I want, I'm pregnant. And you could, but you don't want to eat just everything, especially if what you're craving is not very nutritious. Third trimester, your body's going to need about 500 extra calories, and it is important to be getting these calories from healthier sources. So empty calories that doesn't have any nutrients is not what you want to be seeking your food source from. And I just want to preface this is an approximate. Everybody's going to be a little bit different. If you are at a normal weight when you start your pregnancy, it's going to be more like this. If you're overweight, then your caloric intake may not change a whole lot. It may be less. And then you're not less, but it may not change quite as much. If you're underweight, you may have to add more calories. So it's going to be variable to woman, depending on what you start at when you get pregnant. So around a healthy weight pregnancy means about 1,800 calories in the first trimester, 22 during the second, and 24 during the third. All right. So let's talk a little bit about what that pregnancy diet, those components are. So proteins are the building blocks, right? Those amino acids that are in proteins are really the building blocks for all cells in our body. And this is one of the key factors for a lot of women. And as we're building our blood, as we're growing our baby, the recommended daily amount is about 75 grams or 3 full servings of proteins. Let's talk about this. So whole grains is another important part of your diet. The body's main source of energy is carbohydrates, and quality carbs are more whole grains, natural grains. Definitely, depending on how much you eat before pregnancy, there may be more or less that you're going to be consuming. But whole grains are definitely important for energy and for growing babies. Let's see. They contain lots of really good nutrients such as B vitamins and fiber. Complex carbs can also help combat nausea. So you're going to need around 6 to 7 servings or 6 to 8 ounces a day. And typically a serving size for most people is about the size of their fist. So vegetables are so key. We talk about those really colorful rainbow plates. Vegetables are an incredible source of all of those nutrients, like your vitamins and minerals, your micronutrients. Some things like vitamin A, vitamin C, iron, magnesium, potassium, and folic acid. We want to try to get in about 4 to 5 servings each day. Some days you're going to feel like you're going to crave more vegetables and fruits than others. So sometimes I look at it not on a day, but on a week. Like, how are you doing on the week? Because sometimes when we look at our daily diet, you may go, oh, I didn't really eat enough protein today. But if you ate more vegetables one day and then you ate more proteins another day, that week it kind of balances out. Another important piece of your diet are fats. So fats are super essential. They contribute to your baby's development, specifically brain and eye development for baby. It is also a source of energy and also aids in the absorption of key vitamins such as A, D, E, and K. It is important to note that not all fats are created equally. So you probably heard of hydrogenated oils, right? So hydrogenated oils are oils that our body can't really identify really well and don't know what to do with it. So we want to have a pure, clean source of fats, and those can be found in different nuts. They can be found in like olive oil. They can be found in healthy meats and fish, such as salmon. Lots of good, healthy sources. If you feel like you're not getting enough fats, you can talk with your provider about getting a supplement that might help you with those high quality fats. So, all right. Oh, I didn't mention salt, but salt is definitely one of those other things. And people always thought when I was growing up that salt is just not so good for you. You can overdo salt. And for some people, that could be true if they deal with any kind of heart disease, those kind of things. It can definitely, but we do need salt. Salt is a important part of our diet, is a mineral. And without it, our muscles, our organs, our nerves wouldn't really function properly. It also helps balance our fluids. And because we have that blood volume increase during pregnancy, that is really important. Iodine is also found, and iodine is critical for babies' brain and nervous system development. So about 6 grams a day, around like a teaspoon. So let's talk about micronutrients. I love micronutrients. They are an incredible piece and part of your prenatal nutrition. Following the pregnancy diet, appropriate guidelines, and guidelines do provide you with many of them. So if you're eating a healthy diet, pregnancy diet, then you're gonna get those micronutrients, but it may not be enough. So instead, oftentimes your provider is going to recommend to you to take a prenatal multivitamin, and these are designed to help add in any missing nutrients that you might be not getting through your diet. So everyone's nutritional needs are a little bit different, but the key nutrients that you should be paying attention to when choosing the right prenatal vitamins are that folic acid or folate, calcium, iron, iodine, B6, C, A, and D, all those vitamins, zinc, copper. So there are very many different types of prenatal vitamins. If you are concerned about the source of your vitamins, you can always opt for a whole food vitamin that is sourced through whole foods versus a synthetic based vitamin. There have been studies found that those vitamins do, our bodies absorb those vitamins through whole food based vitamins better than they would through a synthetic source, because our body identifies them, more easily identifies them. But if you're having questions, you can always talk to your provider about that, or another knowledgeable provider source. All right. So next on the list is moving your body. And sometimes we feel like we have lots of energy and we're ready to just like, woohoo, let's do this. I'm excited. I want to move, got all this energy. Other times in pregnancy, we just want to curl up and take naps. So it's important to listen to those days when you feel like you need to take a day off and sleep, and then also move. And oftentimes what I found with women is moving can help alleviate many of the symptoms of pregnancy, especially sleep issues, back pain. Here's a picture here of these ladies doing some exercises with yoga balls or exercise balls. Definitely yoga style and prenatal exercise classes can and does help support strengthening your body, helping alleviate the extra weight of pregnancy by strengthening your back and stretching your back out. If you haven't already checked into different classes for pregnancy, definitely check those out. A lot of the women that we work with really are champions of the benefits of getting that exercise in. typically your provider is going to say, if you started out your conception and you were already exercising, you definitely just continue, right? You will find yourself slowing down in that exercise regimen as you get bigger and closer towards the end of your pregnancy. If you haven't really exercised before, now's the time to do really slow, gentle types of prenatal yoga, getting in and doing maybe a class in a pool where you're getting all that weight alleviated from floating in the pool, and getting some interaction from some specific prenatal exercises. So you're not overdoing it if you haven't already been comfortable with exercise prior to pregnancy. So a couple of experts say that regular exercise during pregnancy results in reduced back pain, relief from constipation, right, and bloating, overall swelling. So you're really moving that body throughout moving that blood volume throughout your body. Also more natural energy. It also helps with mood, which is a lot of these things, even when you're not pregnant, exercise does, right? Also improve quality of sleep, faster postnatal recovery, and may help you in your ability to cope labor. And here's where I'm just going to pause, because I have two mamas that I worked with that I'm really thinking about. One, she couldn't find a prenatal yoga during her pregnancy that would match her schedule. So she went to a gentle yoga class, and the instructor helped her to modify as she got farther along in her pregnancy. Her instructor helped her modify her positions so that she felt comfortable in them as her body changed. She attributes that practice that she did pretty religiously throughout her pregnancy to help her have a really smooth and easier birth experience. And she was a first-time mom. I have another mom who was exercising the day before she went into labor, and she had exercised before, and she just kept that regimen up. And she really attributes her not having any trouble with sleeping during pregnancy, even until the end. She had no trouble with constipation, her mood, energy, sleep were all affected. And she really contributed that to her experience of just continuing her exercise regimen, changing and adapting it, but definitely really championed that a lot. So let's talk a little bit more about prenatal exercise. Specifically, if you're able to find somebody who teaches this is great. It is recommended that you should have some type of exercise 30 minutes a day if you're able. And this can just even be walking, getting outside, doing some indoor stuff as well. But just exercising for 20 minutes a couple of days a week can still really be beneficial. The main goal is that you get moving and get your blood flowing, okay? You can check out, I will send everybody some information, but there is a collection of pregnancy workouts to help you get active on fitpregnancy.com/exercise prenatal-workouts. So you can find 12 great pregnancy exercises there. Does anybody have a favorite way that they've been exercising, or being able to move during their pregnancy that they'd like to share? If you do, just type those into the chat bar. Awesome. So while exercising is super beneficial, it is important to be aware of a couple of the dangers. So talk with your provider. If you do exercise that is too often or too strenuous, you can restrict the amount of oxygen that reaches the uterus. You would have to be pretty intense to do this, but it does happen when you exercise. Your blood flow moves to deliver more ample oxygen to your other parts of your body, like your muscles and your lungs and your hearts, okay? Anytime you're doing exercise, it is good to check with your doctor before either continuing or starting that, and always listen to your body. A couple of things that happen during pregnancy: that blood volume increases. We also have that relaxin, which is that hormone that flows through our body that allows our joints to move a little more freer, and that's going to help you when you go into labor, help that pelvis open up and things. But it can make us a little wobbly, and it can make us, if we're trying to move at a faster pace, we can sometimes injure ourselves. So it is good to always, as you're getting closer towards your delivery time, to be really aware of your movements, not try to make quick movements, but do everything at a slower pace. And you'll typically be great. So let me see if there's anything else I missed. So a couple of specific types of exercises to avoid would be excessive types of exercises that may cause abdominal trauma. So all of those abdominal muscles are kind of being stretched to their limit when we're pregnant. Organs are shifting around, making room for baby. So doing that extensive, like jumping, like hard jumping, also bouncing while stretching might not be really helpful for your joints or your muscles and stuff. And then also twisting at the waist while standing. So really intense. Exercise in hot environments, because as women, sometimes that blood volume can really cause us to be a little lightheaded, and you wouldn't want to pass out or anything or fall. Also activities that could put you up for risk, the slippery activities, ice and snow, those kind of things, just to be cautious. Right. We have a couple of wonderful doulas on our High Country Doulas team who are prenatal yoga instructors, Liz Mitchell and Chelsea Bishop. They both really love yoga. I love yoga too, but I'm not an instructor. And like I said before, one of my former clients really championed the benefits of yoga for her in her actual labor, how she feel like that really helped her. Yoga has a couple different components, but let me share just a little bit more about it. So it's pretty easy these days to go out and find some yoga classes. And if you can't find a specific prenatal yoga class that fits into your schedule, gentle yoga is a good alternative to that, especially if you can get started early on. And as your body starts to get bigger, you can kind of make those adjustments and talk with your instructor to help you make modifications. But in general, it has countless benefits to your physical, emotional, and mental health. And practicing during your pregnancy, your baby's also going to get these wonderful benefits. It's usually composed, typically if you've never been to a yoga class, there's going to be breathing exercises, gentle stretching. Will also be strength building postures and concentrated relaxation. And all of these activities that are done in yoga are very supportive of a healthy pregnancy. So check out your local studios and try to find things. There are a couple resources at prenatalyogacenter.com. There's some online videos, myyogaworks.com, yoga download, and of course YouTube. So hopefully if you're very interested in starting a practice of prenatal yoga, definitely check out those. High Country Doulas does do one-on-one prenatal yoga classes in person. So if you want to start a practice and can't find anything, we can help you get started with that. We'd love to share more about it with you. Awesome. So another aspect that is really helpful to make a practice during pregnancy is breathing. You can do this through a lot of yoga practices, but you can also do this outside. Breathing is a thing that we do the most and think about the least. It is truly essential for both you and your baby. So you provide oxygen to your baby via your blood through your umbilical cord. And when you take nice, long, deep, slow breaths, you're delivering more oxygen into your bloodstream. So when I work with moms, I say this is something that you can practice, even if you're just practicing it while you're going to the bathroom. It's just a practice of taking 3 long, slow, deep breaths, relaxing your entire body with that breath, thinking about your baby as you're doing that, and just listening to the sound of your breath, not thinking, letting go of all other thoughts. Now, if you've done yoga before, you know this is very similar to what you can experience while doing yoga, but I just wanted to share that with you. Your body is really going to need more oxygen, right, to function as your baby grows. And your baby does require that oxygen. So being mindful, sometimes for me, it's just like sticking a sticky note on my desk or putting it on my mirror in the bathroom. And when I am in there, any place that you're present and you might read it, just to help you kind of like pause and focus. And it's really our way that we can pause and connect with our baby and feel our body, listen to our baby. It's really also going to help us have less stress, right? And it's going to help us relax easier. And it will help prepare you to better handle those contractions as you go through your labor and pushing your baby out. It's super helpful. All right. Let's keep going. All right. So another piece to potentially helping support you to have an unmedicated birth is meditation. So meditation and prayer are things that people use to center and ground themselves, to help them be mindful of their body, their physical body and their emotional body. So much like deep breathing, the practice of meditation is really a valuable tool. Some women will do prayer, some affirmations, but just spending some quiet time with yourself. Thinking for some women who've considered using a hypno therapy for birth, such as hypno babies, those types of programs are something that women feel very comfortable getting in and using those. When I work with moms who are interested in that, I really think that it's important to do like a sort of a real good practice in it. I think you can't half do it. So there's hypno babies and hypno birthing. Hypno babies is very different. They teach sort of a medical grade hypnosis techniques and creating a sort of automatically peaceful, relaxing, and comfortable calmness that their practice does. But you can't just kind of read about it without practicing it, or it does take some time to spend with it. There's also hypnobirthing, which is a childbirth education course that does emphasize natural childbirth and teaches self-hypnosis techniques for combating fear and pain. Again, with any of those, it's something that you have to be very dedicated to practicing on your own, or taking an online course that would help you to work through that. Meditation in itself promotes just that calmness, the physical, the mental. It does benefit women and their babies very deeply. And it also is very helpful for women who might be experiencing depression or anxiety during pregnancy. You typically are going to have the benefits of having a more restful and less interrupted sleep. Easing that anxiety can bring you closer to your child by centering yourself and spending some time and creating those bonds, which is really helpful for women, especially if you find yourself not having time. Maybe you're working full time and pregnant and you don't have time to work or sit down with that. A practice of meditation, you can include it in your yoga practice if that was something that you felt drawn to. There's lots of different ways. And as anything, the practice of those kind of things can be beneficial, even if you do it a short amount during the day, but if you're consistent with it. All right, so women have a lot of changes that happen to their body. And studies do show that prenatal massage therapy can offer an array of benefits. Some of those benefits for massage therapy include increased oxytocin flow. So oxytocin, of course, is that wonderful love hormone, helps us to bond with our mates, helps us to conceive, it helps us to go into labor, helps our uterus to get back to its pre-pregnancy size, and it also helps us to supply breast milk to our babies. Lots of different roles there that oxytocin has for us. It also helps us relieve anxiety and depression. It helps us have relief from, but prenatal massage therapy also reduces anxiety and depression. It can help relief from those muscles and joints that we have from carrying a growing baby in our belly. It also can help improve labor outcomes, hormone regulation, cardiovascular health, swelling that we have, nerve pain. Some women deal with nerve pain, increases circulation, and often improves sleep for moms. So creating that birth dream team. Everyone's birth goals are different, right? Everybody has a different view of what their ideal birth looks like. And it is important really to have the people on your birth team that are accepting of those needs and preferences. There are so many important components of a birth team. So in your birth team, you're going to have your medical providers. That might be a GP, typically not, sometimes a family's physician, an OB, a midwife, a doula, a birth partner. Those are all going to be those people that are going to be there. It could also be family members to support you, but those are going to be your kind of go-to birth teams. Those people who know about birth, know what to expect, and can help guide you through that. So choosing someone that you're really comfortable with as a care provider is one of the most important factors to have a positive birth experience. Those who are planning to have an unmedicated birth usually will hire a midwife who are trained in assisting deliveries for a low-risk birth, people who want to have a unmedicated type of birth. A doula is also an asset. That's what we do here at High Country Doulas. We're there to support your goals. We are very knowledgeable about all the processes of birth, both unmedicated and medicated, as well as belly birth. So we support moms no matter what their goals are or outcomes. And we really walk through that mom and partner each step of the way. So we start in pregnancy and we walk through all of those steps as mom goes through it, even into that postpartum period. All right. Your partner is another wonderful piece of that. And they are in many ways know you best, right? They know what your goals are. They want to support you, and they want you to be safe, and they want you and your baby to be healthy. They are there. So walking through this role and talking to your partner as you go through this on what your goals are is really important, so that they understand, because partners sometimes just want safety. And so if they don't understand something, it's really hard for them to support it. So having those conversations during pregnancy to talk about what your goals are for your birth are really important. They have the responsibility of providing emotional and physical support to you throughout everything. And above all, they can help articulate your needs. They can ask for help when you need it. They can speak up for you. Oftentimes it's really hard for a woman who's in the throes of active labor to communicate and to share those goals. So your partner is one of those people there who's there for you, knows what you want, and can help you with that. So where do you want to have your baby at? So that is another piece of the puzzle. You may not have a choice with this because your provider may just work at one birthing facility. So it's another piece of that puzzle. What type of setting you want to have, what options does that birthing facility have to support your goals? Do they have all the tools that you would like to use during your birth? And if they don't, can you bring some of those in? So thinking about that. And we love to help moms and partners figure out the different techniques to help support them if they're wanting to have a unmedicated birth. Our comfort measures class is one of our most popular classes, and we do walk through all the types of techniques that can be super helpful for mom, and partners love to learn that. They love to get that hands-on learning aspect. And we even talk about epidurals. We talk about all those kind of tools, but we do a lot of the non-medicated types of comfort measures, because we know that even if you're planning on getting an epidural, you're going to probably be in labor at some point and have to handle it. So it's important to feel comfortable walking through each of those stages of labor with confidence. All right, let's talk a little bit more. So some other tips for you to prepare for an unmedicated birth are to take some prenatal classes to help you get ready for that birth. So childbirth education types of classes, either through our wonderful classes or somebody else's. It's important to get educated. And oftentimes we have couples who come to our classes and go to the hospital classes. They want to know all of it. They really want to know as much as they can to help themselves feel comfortable walking into labor and birth. Another tip would be to just envision what those birth expectations are. Note that those may change as you move through your pregnancy. They may change in labor. You have the right to change those as you walk through this. Communicate your needs. So communicate what are your desires. Talk with your partner about those. Talk with your birth team about what you are. If you want to create a birth plan or birth wishes, communicate that with your providers. Let them know, this is what I'd like to do. Can this happen? What can we do to make this happen? Or, what are my alternatives? Also, just educating yourself as much as you can about natural childbirth. If you're a podcaster, if you're a reader, if you're a YouTube watcher, if you're get all those sources so that you can make those decisions. And learn all of your options, because you're going to connect with specific options. You're not going to be just like the other mom who also may want an unmedicated birth. She may not like tubs, and she may be like, oh, I don't want to get in the tub at all. That sounds awful. But she may like showers. So everybody's going to have a different idea of what feels like something that would be comforting to them. The most important piece of advice is to believe in yourself. So you are amazing, you are strong, you know yourself best. So believe in yourself, believe in your body's ability to birth your baby. The female body is really designed to grow another human efficiently and welcome them into the world. Whenever you begin to feel nervous or afraid, anxious, just remind yourself that birth is a natural function. You're not are not ill, and you're designed to do that. Right. There's a couple additional incredible books on childbirth that you might be interested in. There's a book called Childbirth Without Fear by Dr. Grant Lee Reed. The Birth Partner by Penny Simpkin. Birthing from Within by Pam England and Rob Horowitz. There's the Bradley Method, Natural Childbirth the Bradley Way by Susan McCutcheon. Gentle Birth Chart Choices by Barbara Harper. Ina May's Guide to Childbirth by Anna May Gaston. And lots of other books out there that you can use to find out what are the choices that you are really connecting with as you go through this journey. So congratulations. so excited for you to have your baby, hopefully sometime this year in 2020. And thanks for coming out with us tonight to talk about this. And I'll take questions. I'm going to go off. Thanks again for being with us.